imagine their mouth not being able to come together when they talk, when they drink, when they eat, when they interact. Could only start to get the tip of the iceberg of what it'd be like if you had a cleft going from your mouth up into your nose that could never close.
Cleft lip and palate is a congenital disorder. The palate is extremely important in terms of speaking and swallowing properly. Most children that have cleft palate also have hearing impairment. I'm Michael Cunningham. I'm the medical director of Seattle Children's Craniofacial Center.
And I'm Richard Hopper, surgical director of the Craniofacial Center at Seattle Children's Hospital. Because Africa really thrives on being part of a larger community, when you have somebody with a facial disfiguration, they are largely shunned from that larger group. It just is completely devastating. I could never just describe the stories that you hear of mothers with children born with clefts and what they're told to do to their babies. The program that we have now is called PACT, Partners in African Cleft Training.
I have a very, very distinct memory of arriving in Kumasi. The first thing that you notice is intense crowding of patients in the facilities, waiting for hours, if not days, to get care.
The need is almost overwhelming, and that's why we focus on developing a team.
Most of the programs around the country are treatment programs, but none of them are designed to be training programs, and that's been our mission from the start.
Surgeon, for example, going to Africa for a week, doing 1 or 2 or 3 surgeries a day because they're teaching 4 trainees each time. Those 4 people will pull in one of their co-workers and say, hey, I have to show you what I just learned. And they'll teach somebody that technique. That effect is continuing to compound on itself, and patients are being treated week after week after week after week. I think the learning experience overall has been one of humility. You can't come to a solution unless you at least start to understand the problem and the environment. Before PACT, I never had the opportunity to work with or observe an African surgeon in action.
The way they interact with one another, the way that they have respect for one another is really, really unique.
The feeling that you get from the African families the first time you meet them is one of shyness. But once their child goes back to them with a repaired cleft, they're feeding their babies, they're holding their babies, they want us to take photographs of them with their babies, they're smiling.
The effort that you put into a 4-month-old child or a 1-year-old child leads to a life that has really changed, literally. Things like marriage and employment change as soon as you can close the lip.
The most rewarding thing is feeling part of something bigger than myself. The whole feeling of PACT is one team, one spirit. You're not in this alone. You're helping kids with clefts together. And as you leave the hospital on that hot African night, the sky has that funny purple color that the African nights have, and the sounds around you, people singing, or the birds are around you. You're just walking back with these African team members and trainees, and all of a sudden you just feel that African feel of community. Michael and I, the entire Seattle Children's team, all members of PACT, remain dedicated to keep this moving forward. By building quality into that ever-increasing flow of education, it doesn't take long before those numbers reach the thousands. And then you start to get on the scale of the burden of clefts in Africa. And I think only in that way can you ever hope to address that burden.